Hello, and welcome to the Heart Health presentation. Our agenda for today includes know the difference between cardiac arrest and heart attack, understand the importance of emergency treatments for cardiac events, learn 3 behaviors to improve your heart health. We're going to start today's presentation with a pop quiz. Which of the following are signs of a heart attack? Fainting? Usually not. A person who's having a heart attack may feel faint, but loss of consciousness is not typical. Chest pain, absolutely. Chest pain or pressure, even the feeling of heartburn may be present. Sometimes this pain runs down the left arm as well. Jaw pain, definitely. More often women get this symptom, not typically men. No heartbeat, usually not. A heart attack victim's heart is usually able to beat, but the blood flow to their heart is lower than it should be, so if left untreated, the heart muscle could die. Cold sweats? Yes. Similar to jaw pain, cold sweats are more often a symptom for women than men. Back pain? Again, this is a symptom for women more than men. Sudden cardiac arrest happens when the heart suddenly stops beating. Cardiac arrest usually happens because the heart goes out of its usual rhythm called arrhythmia. If this happens, blood stops flowing to the brain and other vital organs. Sudden cardiac arrest usually causes death if it's not treated within minutes. Before the event actually happens, there are usually no symptoms. When the incident occurs, the person usually faints and does not respond. When a pulse is checked, there is no heartbeat because the heart has stopped. Heart attack or myocardial infarction happens when the flow of blood to the heart is blocked. The heart usually does not stop beating during a heart attack, although in rare cases it can if the blockage is severe enough to not allow blood to flow in the heart. Coronary artery disease is typically why heart attacks happen in most cases. There is an injury to the artery and the body's response is to fix it, so it sends plaque, which is like rubber cement, to the injury. Plaque is hard and sticky and causes bad cholesterol to stick to it. If too much is built up, it can harden the arteries and cause what is called atherosclerosis. When a plaque breaks, a blood clot forms around the plaque. The blood clot may block the artery and block the flow of oxygen-rich blood to the heart, causing a heart attack. Cardiac arrest can happen during or after recovery from a heart attack. Women and men experience different symptoms. Typically, there is upper body discomfort or pain, which can be in one or both arms, the back, neck, jaw, and/or stomach. The most common symptoms for men is chest pain or discomfort. Women are more likely than men to experience other symptoms listed on this slide. Unless you are a doctor, nurse, or EMT, you are not expected to treat someone, but you can provide a few saving steps for that person. Pop quiz. What is the first thing you should do when you think someone is having a cardiac arrest or heart attack? If you said call 911, you are correct. Now that you know the information, you shouldn't have to Google it. Do not begin CPR until you get emergency crews on their way to you. Looking for someone else to help will waste valuable time. In the event that you think someone is having a cardiac arrest, the first and most important thing you can do is call 911. If an AED machine or automated external defibrillator is available, have someone get it and you begin CPR, or vice versa. As soon as the AED machine arrives, use it. Continue CPR or using the AED machine until the EMS team arrives. If the person is having a heart attack, make sure the person sits down, rests, and keeps as calm as possible, then call 911. If the person is unresponsive, call 911 and then begin CPR if necessary. Loosen any tight clothing to make the person more comfortable. If the person takes any chest pain medicine like nitroglycerin, help them take it. Taking aspirin has been recommended to increase survival rate in heart attack victims. Hands-only CPR is recommended for use by people who see a teen or adult suddenly collapse in an out-of-a-hospital setting. CPR stands for cardiopulmonary resuscitation. This means you are bringing back heart and lung function through your breathing and chest compressions. CPR can force blood to circulate in the body so that it prevents brain damage. CPR includes chest compressions as well as artificial respiration, which is mouth-to-mouth rescue breathing. Hands-only CPR is CPR without mouth-to-mouth breaths. According to the American Heart Association, hands-only CPR is as effective as CPR with breaths. The American Heart Association has recommended hands-only CPR for adults since 2008. 88% of cardiac arrests happen in the home, so the chances that you could save a direct family member's life is very high. Starting to treat it right away can mean life or death. Cardiac arrest may be reversed if CPR is performed or a defibrillator is used to shock the heart and restore a normal heartbeat. There are many training classes for CPR available. You can be trained and or certified in CPR for adults, children, and infants. These are taught by trained instructors and classes are held locally. To find a class near you, log on to the Red Cross, American Heart Association, or your local hospital, fire company, EMS station for local certified CPR classes. An AED or automated external defibrillator. This is a machine that is lightweight, battery operated, and portable. The purpose is to check the heart rhythm, and then if the heart is out of rhythm, it will send an electric shock directly to the heart, bringing back a normal rhythm. Each machine comes with instructions, and some even give voice prompts for each step to guide you through. You have probably seen stickers on the doors of malls, airports, and other public places that indicate there is an AED machine on the premises. It is great to be informed about cardiac arrest, heart attacks, CPR, and AED machines, but what do we do with that information? Ideally, you want to change different behaviors to improve your heart health so you can avoid cardiac arrest and heart attacks, among other heart-related diseases. Knowing what you know about your health and heart disease, what changes can you make in your lifestyle to improve your heart health? Some responses may be eat better, exercise more, quit smoking, get more sleep, and reduce stress. Yes, all of those are excellent changes you can do. Today, we're going to talk specifically about eating better, exercising more, and stressing less. Eating well can reduce the risk of all chronic diseases. There's a lot of research on improved eating behaviors and heart health. The Mediterranean diet is one of the most researched diets for heart health, and these are the basic guidelines. Eat a balanced diet of mostly plant foods like fruits, vegetables, whole grains, nuts, and legumes, including beans, peas, and lentils. Cold water fish is also a big part of this diet due to the omega-3 fatty acids, which are really heart healthy. These fats are all shown to reduce bad cholesterol, the LDL, and increase good cholesterol, the HDL. You can also get omega-3 fatty acids from plants like walnuts, flaxseed, chia seed, and canola oil. Eating less high-fat foods, especially those high in saturated and trans fat, will reduce the risk for heart disease. Saturated fats are found in solid fats like butter, sour cream, cream cheese, and meat, especially red meat like beef, pork, and lamb, and skin of chicken. Saturated fats bring up bad cholesterol, the LDL, and can lead to plaque buildup, like we talked about earlier. Trans fats are man-made fats that are terrible for your heart. These fats not only increase your bad cholesterol, the LDL, but they decrease your good cholesterol, the HDL, which is very bad for your heart. Trans fats are called partially hydrogenated oils and are found in stick margarine, shortening, baked goods, and hidden in foods like peanut butter and powdered hot chocolate. Eating less portions of most foods can help to manage weight. Weight loss when a person is overweight or obese can reduce the risk of heart disease, especially if the waist circumference goes down. Decreasing sodium salt intake can reduce blood pressure, which can improve heart and artery health. And overconsumption of alcohol can not only hurt the liver and other organs, but has a huge impact on heart health. Calcium-rich foods can be dairy foods like cheese, milk, and yogurt, or non-dairy calcium-rich foods like dark greens, soy, and fortified foods. Heart-healthy fats are a very important part of this diet in moderation. These include oils like olive oil, canola oil, or other vegetable oils, nuts like walnuts, pecans, cashews, almonds, and peanuts, as well as seeds like sunflower, pumpkin, flax, and chia. Exercise can strengthen the heart muscle. 150 to 300 minutes per week is recommended for cardiovascular aerobic activity. It is also beneficial to add in muscle strengthening and flexibility at least 2 days per week. Stress has a big impact on your heart health. Not only does stress increase your blood pressure, but chronic stress has shown to increase heart disease. Researchers are not quite sure how stress increases the risk, but many believe that it increases risky behavior associated with increased risk for heart disease. Stress may affect behaviors, increase heart disease risk like smoking, physical inactivity, and overeating. Some people may choose to drink too much alcohol or smoke cigarettes to manage their chronic stress. However, these habits can increase blood pressure and may damage artery walls. When you have acute or sudden stress, stop what you are doing and try to calm yourself down. Breathe deeply and count to 10. Go for a walk to get your mind off of things. Find pleasure in the little things in life. Take a walk in nature, have coffee with a friend, go for a leisurely car ride. Take 15 minutes for yourself. Have quiet time, say prayers, or meditate. A warm bubble bath, practicing yoga positions, and taking a walk are all ways you can relax in just 15 minutes. Be positive. You can be positive in all situations. Attitude is everything. Knowing that you can accomplish your goals, be healthy, reduce stress, increase physical activity, eat better, can encourage you to keep moving forward. Remember, small changes make big impact. Review some of the small changes you can make for eating better, exercising more, or stressing less. What changes are you thinking? Next steps. Moving forward, what are you taking away from this presentation today? What are you wanting to move forward with after hearing this presentation? Case management. Sometimes it takes a team to manage your health. The Capital Blue Cross Case Management Team is on standby to help you with complex medical needs, including maternity care, cancer treatment, chronic conditions, and medical transplants. Programs include Precious Baby Prints, oncology care management, transplant care case management, chronic conditions, and complex medical conditions. Create your own secure member portal at capitalbluecross.com and gain access to your member services. HealthWise Knowledge Base. Access the knowledge base through your Capital Blue Cross Secure Member Portal after logging in and going to the Wellness section. In here, you can search thousands of topics and use the tools to help you make more informed decisions about your health care. NurseLine. Get health questions answered 24/7. Questions about your health can come up at any time, day or night. With NurseLine, pick up the phone and talk to a registered nurse. This service is free for our Capital Blue Cross members. Or log on to your secure member portal to start a chat session instead. Blue 365. This offers health and wellness deals exclusive to you as a Capital Blue Cross member. Blue 365 offers discounts on fitness, personal care, healthy eating, financial health, lifestyle, and wellness. My Care Finder. Search for doctors, specialists, facilities, get treatment cost estimates, and find treatment timelines. Capital Blue Cross does not endorse these apps, and these are simply additional resources that you can browse on your own. For additional resources, take a look at the references used for this presentation. Thank you for listening to the Heart Health presentation.